or 642.7 or 011014, and billing for 99215 for comprehensive history, physical examination, and high complexity decision making in 40 minutes. The Family Medicine Rotation at Hereford Internal Medicine Residency Program Director improved my clinical acumen with a 40-year-old African American female who said, "I have abdominal pain as a chief complaint for 2 days, a history of present illness and fatigue, malaise, 9 over 10 sharp constant non-radiating epigastric pain, nausea and vomiting of non-body food contents, pathological history of diabetes mellitus type 2, obstetrics and gynecology history of last menstrual period 4 weeks ago, every 4 weeks, lasting for 4 days, and use of two pads daily, no history of sexually transmitted diseases, and currently on oral contraceptives, current preventive care, social history of college graduate, unemployed, lives with family, married with husband and 3 children and no non-drug allergies, concordant review of systems and physical examination findings of mouth distress, ketone breath odor, dry mucous membranes, reproducible epigastric pain, differential diagnosis of alcoholic ketoacidosis, appendicitis, hyperosmolar coma, electrolytes imbalance, lactic acidosis, metabolic acidosis, myocardial infarction, acute pancreatitis and pneumonia, and laboratory orders of urine pregnancy tests, serum blood glucose, comprehensive metabolic panel, arterial blood gas, urinalysis for elevated ketones and beta hydroxybutyrate, serum osmolality, urine osmolality, amylase, lipase, blood culture, erythrocyte sedimentation rate, C-reactive proteins, procalcitonin levels, cerebrospinal fluid analysis, lumbar puncture with positive findings of positive blood cultures, imaging of chest radiography, magnetic resonance imaging, computed tomography, electrocardiography and telemetry, assessment of diabetic ketoacidosis and bacteremia, and plan of rehydration with isotonic sodium chloride replaced with 5 to 10% dose with half isotonic sodium chloride solution, switching hyperglycemic therapy to regular insulin within 6 units per hour per 15 milliliters per hour therapy, potassium chloride, pedol 10 ml equivalent per hour, antibiotic therapy of ceftriaxone 1 gram daily intravenously, follow up after 2 weeks of discharge to home, coding of ICD-9, ICD-10, 450 or E10.1 to E14.1, and billing of 99205 for a new patient with comprehensive history, physical examination and high complexity decision making in 60 minutes. My interest in the American Academy of Family Physicians downward smoking cessation campaign started subsequent to care delivery to a 70-year-old African American male who presented to the emergency room and said, "I have a cough," as chief complaint and history of present illness and cough, productive of greenish sputum, subjective fever, shortness of breath, 8 over 10 constant non-radiating pleuritic chest pain for the past 2 days, pathological history of chronic obstructive pulmonary disease, current preventive care, social history of graduate school, lawyer, married with 4 children, living with family, exercises 3 times a week, smoked 1 pack of cigarette a day for the past 40 years, social history, albuterol and ipratropium, convivent 100 micrograms per 20 micrograms every 6 hours, and no drug allergies, with concordant review of systems, physical examination findings of severe respiratory distress, tachypnea, fever of 100 degrees, increased jugular venous pressure, cyanosis, elevated jugular venous pulse, JVP, hyperinflation, barial chest, wheezing, diffusely decreased breath sounds, hyperresonance on percussion, prolonged expiration, cyanosis and peripheral edema, and differential diagnosis of alpha-1 antitrypsin deficiency, bronchitis, emphysema, pulmonary embolism and asthma, and laboratory findings of complete blood count, comprehensive metabolic panel, arterial blood gas, ABG, alpha-1 antitrypsin deficiency, bronchitis, bronchitis, emphysema, pulmonary embolism and asthma, and laboratory orders of complete blood count, comprehensive metabolic panel, arterial blood gas (ABG), alpha-1 antitrypsin level, sputum evaluation, serum beta type natriuretic peptide, imaging of chest radiography, computed tomography, two-dimensional echocardiography, right-sided heart catheterization, consult with pulmonology and infectious disease, and assessment of chronic obstructive pulmonary disease exacerbation, and treatment plan of albuterol, Proventil, nebulizer solution 0.5 ml of 0.5% solution, 2.5 milligram over 5 to 15 minutes every 4 to 8 hours is needed for shortness of breath. Methylprednisolone, Solumedrol, 16 milligrams intravenously and orally when tolerating oral intake. Doxycycline, Vibromycin, 100 milligrams twice daily intravenously and orally when tolerating oral intake. Follow up with family physician 1 week after discharge, and coding of ICD-9, ICD-10, 490 to 496, J for the 4.1, and billing of 99205 for a new patient with comprehensive history and physical examination and high complexity decision making in 60 minutes. I was the internal call when a 60-year-old African American male was brought into the emergency room and said, "I have a chest pain," as the chief complaint and history of present illness of 9/10 constant sharp left chest pain, radiating to the left arm, worsened by exertion and relieved by rest for the past 1 day. Diaphoresis of nausea and vomiting of non-bilious food products. Pathological history of hypertension, current preventive care, social history of college graduate, married with 1 child, living with family, exercises 3 times daily, tobacco smoking of 1 pack per day for the past 10 years, social drinker, on hydrochlorothiazide 50 mg once daily, and no known drug allergies. For further review of systems, physical examination of severe distress, elevated blood pressure, fever of 100 degrees, irregular pulse, decreased jugular venous pressure, copper wiring or narrowing of arterioles, arteriovenous leaking, cupping or loss of the margins of the optical disc, arteriolar narrowing and hemorrhages and fundoscopic examination, coarse crackles in bilateral lower fields, displaced epical impulse, S3 and 4/6 systolic murmur in the left sternal border, non-pitting peripheral edema with differential diagnosis of acute coronary syndrome, angina pectoris, anxiety disorder, aortic dissection, aortic regurgitation, aortic stenosis, asthma and biliary tract disease, laboratory orders of cardiac biomarkers of creatinine kinase, troponin and lactate dehydrogenase, complete blood count, comprehensive metabolic panel, urinalysis, lipid profile and C-reactive protein, imaging of electrocardiogram with ST elevation, ST depression and Q waves, stress echocardiography, coronary artery calcium scoring, and assessment of myocardial infarction and plan of intravenous access, supplemental oxygen pulse oximetry, aspirin 325 milligrams orally or Zopray, nitroglycerin 0.3 mg sublingually every 5 minutes, clopidogrel, Plavix, morphine, MS-contin, follow-up in 4 weeks, coding of ICD-9, ICD-10, 412 and 125.2, and billing of a new patient 99204 with comprehensive history and physical examination and moderate complexity decision making in 45 minutes. My interest in gastroenterology started after having a 28-year-old Asian female who came into the clinic and said, "I have diarrhea," as the chief complaint with history of present illness of diarrhea of mucus stool, 8/10 left lower quadrant, constant dull aching, non-radiating abdominal pain, abdominal distension related to stress, meeting the wrong 3 criteria for the diagnosis of irritable bowel syndrome, past medical history of depression, current preventive care, social history of college graduate, nurse, living alone, single, exercising 3 times a week and no known drug allergies, concordant review of systems, physical examination findings of mild distress, reproducible left lower quadrant abdominal pain and palpation, differential diagnosis of abdominal angina, anxiety disorders, bacterial overgrowth syndrome, biliary colic, biliary disease, celiac flu, chronic mesenteric ischemia, collagenous and lymphocytic colitis and colon cancer, laboratory findings of complete blood count, comprehensive metabolic panel, stool examination for ova and parasites, enteric pathogens, leukocytes, Clostridium difficile toxin and Giardia allergy, hydrogen breath testing, tissue transglutaminase antibody testing and small bowel biopsy, thyroid function test, serum calcium, erythrocyte sedimentation rate, C-reactive protein, imaging of upper GI barium study with small bowel follow-through, double contrast barium edema, gallbladder ultrasonography, abdominal computed tomography scan and assessment of irritable bowel syndrome and treatment plan of psychological support, dietary measures and dicyclopine, bentyl 20 mg orally every 6 hours, loperamide, Imodium 4 mg initially, then 2 mg after each stool, imipramine, dofranil 75 mg orally every day, allocetrol, Lotronex 0.5 mg orally every 12 hours, follow up in 1 week. Coding of ICD-9, ICD-10, 564.1 or K58 and billing of 9902 as a new patient with expanded focused history and physical examination and straightforward decision making in 20 minutes. Hematology and oncology became fascinating to me after the African American 11-year-old male came into the clinic and said, I have abdominal pain as the chief complaint, with history of present illness of generalized pain, fever and failure to thrive, past medical history of sickle cell disease, current preventive care, social history of living with family on ibuprofen and no known drug allergies, concordant review of systems and physical examination findings of hypertension and tachycardia, dyspnea and fever, scleral icterus, abdominal or corkscrew-shaped blood vessels, pale mucous membranes, systolic murmur over the entire pericardium, splenomegaly, reproducible abdominal pain, inflammation, pain, and decreased range of motion of the extremities, concordant review of systems, differential diagnosis of valvular heart disease, septic arthritis, sepsis, upper respiratory tract infection, aortic arch syndrome, and hemolytic anemia. Laboratory orders of comprehensive metabolic panel, complete blood counts, erythrocyte sedimentation rate, urinalysis, blood culture, arterial blood gas, imaging studies of radiography, magnetic resonance imaging, computed tomography, magnetic resonance imaging, transcranial Doppler ultrasonography, abdominal ultrasonography, echocardiography, assessment of sickle cell disease and treatment plan of hydroxyurea, drugs here, 20 mg per kilogram orally every day, oxycodone, aspirin, Recordant 1 tablet orally every 6 hours needed for pain, folic acid 400 microgram per day orally, cefuroxime, Ceftin 500 mg orally every 12 hours for 10 days, sildenafil, Revasio intravenously 2.5 milligrams, coding of ICD-9, ICD-10 to 82.60, D57.1 and billing of 99205 as a new patient with comprehensive history and physical examination and high complexity decision making in 60 minutes. This synopsis portrays a typical day in the life of an intern with patient care. The man armed with accreditation council, running medical education competency training from medical school, supervised by a resident while maintaining a balanced life with hobbies and healthy mental and physical habits, which I hope to contribute by providing a collaborative environment for running medical education with my hobbies of Zumba dancing and charity works on Drchikitomentoring, Iridiscence education, Ustream, YouTube, Cisco WebEx, Brainshot show, and resumed joint custody of my 3-year-old son as a single mother, incorporating my strengths of dedication to medicine, interest in education and creativity, and experiences from various medical education programs, and achieve my graduate medical education goals within the next few years. Psychiatric personal statement. I would like to share my psychiatric personal statement with you. My choice to be a physician stems from educational and physician leaders from early developmental years to graduate medical education and real-life stories of patients whose lives have been transformed by healthcare in my family, patient care, and various charity works, and be a part of effective, innovative, cutting-edge healthcare delivery. Hello everyone, I'm Dr. Drchikitomentoring, MD, a 2007 graduate of American International School of Medicine. My typical introduction to community educational Ustream shows discussing the essential skills for patient encounters and components of the clinical decision-making process, and the role of graduate medical education curriculum with its diversified topics ranging from emergency protocols, patient encounter, coding and billing, electronic health records and practice management, contributing towards effective healthcare delivery. Healthcare integrates the fine art of addressing patient symptoms and physical examination findings, integrating humanitarian qualities, pharmacology and psychotherapy, which have worked in the past, with continuous innovative healthcare delivery, creating healthcare opportunities from the United States of America, Taiwan, Africa, and Russia with healthcare professionals, systems and health information technology with personalized patient-centered approach, didactics and healthcare delivery systems, and specialization opportunities. Psychiatry is unique to me due to the opportunity it offers for the fine arts of producing stable patients by integrating pharmacology and counseling with the quintessence knowledge of the patients and teaching them the art of stress management. My clinical career has been shaped by medical education and United States medical licensing examination scores of Step 1, Step 2 clinical knowledge, Step 2 clinical skills, Step 3 scores of 88 or 212, 98 or 257, pass 88 or 212, and improved the training for clinical rotations in the United States of America at Atlanta Medical Center and Crawford Long Hospital, Atlanta, Georgia. Observerships at Texas Health Harris Methodist Hospital, Fort Worth in internal medicine with Dr. Fidelis Ineni and Huntsville Family Medicine Residency Program, Huntsville, Alabama. In family medicine, interning service with the program director, Dr. Mary Cristani, and the inpatient team. Externship at Resurrection St. Elizabeth Hospital, Family Medicine Residency Program in Family Medicine with Program Director Emeritus Dr. Saida Zahidi, and Graduate Medical Education Training at Henry Ford Internal Medicine Residency and Southern Illinois Family Medicine Residency Program, Springfield, Illinois, with inpatient, outpatient, and obstetrics and gynecology rotations with Program Directors Dr. Kimberly Baker-Janor and Dr. Janet Albers, and continuously updated with Graduate Medical Education and Caregiving in Dallas, Texas, and enhanced with a Master's in Business Administration, Core Public Health Administration, and ongoing public health at Capella University, Minneapolis, Minnesota. Collaboration with the American College of Physicians, American Academy of Family Physicians, American Psychiatric Association, American Pediatric Association, current practice recommendations have improved my accreditation council collaboration with the American College of Physicians, American Academy of Family Physicians, American Psychiatric Association, American College of Obstetrics and Gynecology, and American Pediatrics Association with current practice recommendations have improved my accreditation council graduate medical education core competencies tremendously with core skills of comprehensive history and physical as a prospective intern in a graduate medical education program. A fascinating 72-year-old female teacher who I saw at Southern Illinois University Family Medicine Residency Program with a 4 to 5 year history of controlled diabetes, ICD code ICD-9 code 279.4, who presented with chief complaints of insomnia and history of present illness of loss of interest in her usual activities, guilt, fatigue, weight gain, and hallucinations, which she attributed to her chronic illness due to her current unemployed status for 4 weeks. Concordant review of systems. Physical examination findings which revealed a disheveled, cachetic woman, psychomotor retardation, slow speech, illogical thought process and thought content with hallucinations, thoughts of suicide, decreased concentration and orientation, reading and writing abilities, visual spatial abilities, memory, abstract thoughts, general fund of knowledge and intelligence, and screening with screening tests including the Patient Health Questionnaire 9, EHQ9, Beck's Depression Inventory, Zong Self-Rating Depression Scale, Center for Epidemiologic Studies Depression Scales, CESD, the Hamilton Depression Rating Scale, the Geriatric Depression Scale, GDS, and the Codial Scale for Depression in Dementia, with differential diagnosis of dissociative disorders, hypochondriasis, hypoglycemia, hypopituitarism, schizoaffective disorder, schizophrenia, and somatoform disorders. Laboratory testing of complete blood count, CBC, thyroid stimulating hormone, TSH, vitamin B12, rapid plasma reagin, RPR, human immunodeficiency disease, comprehensive metabolic disorders, blood alcohol level, blood and urine toxicology screen, arterial blood gas, ABG, dexamethasone suppression tests, gossitropine, ACTA stimulation tests for Addison's disease, imaging of computed tomography of the head, magnetic resonance imaging of the head, and positron emission tomography with assessment of major depressive disorder and plan of psychotherapy. Bupropion, Wellbutrin 150 mg orally daily, ICD-9, ICD-10 29.20, F32.9. She was also educated on the various antidepressants and their mode of action. She gradually weaned off medications after several engaging continuity clinics, and I ended up becoming close friends with her after finishing my rotations. A fascinating 32-year-old resident who I saw in medical school with chief complaints of insomnia and history of present illness, of loss of interest in her usual activities, guilt, fatigue, weight gain, and hallucinations, which she attributed to her boyfriend and neighbors due to her current unemployed status for 4 weeks. Physical examination findings which revealed a disheveled, cachetic woman, psychomotor retardation, slow speech, illogical thought process and thought content with hallucinations, thoughts of suicide, decreased concentration and orientation, reading and writing abilities, visual spatial ability, memory, abstract thoughts, general fund of knowledge and intelligence, and screening with screening tests including the Patient Health Questionnaire 9, PHQ-9, Beck's Depression Inventory, Zong Self-Rating Depression Scale, Center for Epidemiologic Studies Depression Scale, CESD, and Hamilton Depression Rating Scale, the Geriatric Depression Scale, GDS, and the Codial Scale for Depression in Dementia, with differential diagnosis of dissociative disorders, hypochondriasis, hypoglycemia, hypopituitarism, schizoaffective disorder, schizophrenia, and somatoform disorders. Laboratory testing of complete blood count, CBC, thyroid stimulating hormone, TSH, vitamin B12, rapid plasma reagin, human immunodeficiency disease, comprehensive metabolic disorders, blood alcohol level, blood and urine toxicology screen, arterial blood gas, ABG, dexamethasone suppression test, gossitropine ACTA stimulation test for Addison's disease, imaging of computed tomography of the head, magnetic resonance imaging of the head, and positron emission tomography with assessment of major depressive disorder and plan of psychotherapy. Bupropion or Butrip 150 mg orally daily, ICD-9, ICD-10 29.20, F32.9. She was also educated on the various antidepressants and their mode of action. She gradually weaned off her medications after several engaging continuity visits, and I ended up becoming close friends with her after finishing my rotation. The 33-year-old African American was in severe distress and cried uncontrollably when she was brought in by the ambulance into the emergency room and said I was raped. As the chief complained 1 hour ago, the history of present illness of inflicted physical injuries and unprotected sexual abuse, past medical history of depression, past medical history of a cesarean section 5 years ago, obstetric history of last menstrual period 4 weeks ago, every 4 weeks on oral contraceptives, current preventive care, social history of unemployment, high school graduate, single and use of marijuana for 7 years, and no known drug allergies with concurrent review of systems, physical examination findings of severe distress, bleeding, laceration on the face, arms and trunks, vaginal lacerations, and differential diagnosis of blunt abdominal trauma, abruptio placenta, acute coronary syndrome, alcohol and substance abuse evaluation, soft tissue injury, anxiety, asthma, vaginitis, and malingering, and laboratory orders of urine or serum pregnancy tests, serologic tests for syphilis, hepatitis B, human immunodeficiency disease, vaginal culture for wet mouth, gonorrhea, chlamydia, trichomonas vaginalis, bacterial vaginosis and candidiasis, procedures of colposcopy, consults of obstetrics and gynecology and psychiatry, an assessment of sexual abuse and treatment plan of ceftriaxone 125 mg intramuscularly in a single dose, metronidazole 2 grams orally as a single dose, and azithromycin 1 gram orally in a single dose, and 2 oral tablets, and 2 tablets 12 hours later for pregnancy prophylaxis. Tetanus, hepatitis B prophylaxis and counseling with a sexual counselor. Follow up with obstetrics and gynecology in 1 week, coding and reading of ICD-9 E960.1 or T74.2, and billing of line 9202 as a new patient with detailed history, physical examination, and low complexity decision making in 30 minutes. Patient education during the clinic visit on the role of neurotransmitters, acetylcholine and catecholamines, dopamine, norepinephrine, and epinephrine, also called adrenaline, and corticotropin releasing factor CRF, a stress hormone and neurotransmitter, lifestyle modification of integrating family support, community involvement, hobbies, and a healthy lifestyle, and medication compliance and continuity of care is essential to ensure physical and mental health. Psychotherapy and counseling with several approaches, including cognitive behavioral, interpersonal, and talk therapy help in depression. Psychotherapy helps people identify the factors that contribute to their depression and deal effectively with the psychological, behavioral, interpersonal, and situational contributors. Skilled health and mental health professionals, such as licensed psychologists, can work with individuals who are depressed to pinpoint the life problems that contribute to the depression and develop problem-solving skills and identify negative or distorted thought patterns that contribute to feelings of hopelessness and helplessness that accompany depression, and develop styles which include developing or strengthening social networks and creating coping mechanisms and lifestyle changes. This synopsis portrays a typical day in the life of an intern with patient care and with accreditation council granted medical education core competency training from medical school, supervised by a resident while maintaining a balanced life, hobbies, and healthy mental and physical habits, which I hope to contribute by providing a collaborative environment for granted medical education. With my hobbies of Zumba dancing and charity works on Drchikitomentoring Iridiscence Education, Ustreamyoutube, Cisco Event Brain Shock Show, and resumed joint custody of my 3-year-old son as a single mother, incorporating my strengths of dedication to medicine, interests in education and creativity, and experiences from various graduate medical education programs, and achieve my graduate medical education goals within the next few years. I would also like to share my pediatrics personal statement with you. My choice to be a physician stems from educational and physician leaders from early developmental years to graduate medical education and real-life stories of patients whose lives have been transformed by health care in my family, patient care, and various charity works, and be a part of effective, innovative, cutting-edge health care delivery. Hello everyone, I'm Dr. Chinyere Ugoji, MD. It's a 2007 graduate of American International School of Medicine. My typical introduction to community educational Ustream shows, discussing the quintessential skills for patient encounters and components of the clinical decision-making process, and the role of graduate medical education curriculum with its diversified topics ranging from emergency protocols, patient encounter, coding and billing, electronic health records, and practice management, contributing towards effective healthcare delivery. Healthcare integrates the fine arts of addressing patient symptoms and physical examination findings, integrating humanitarian qualities, pharmacology, and psychotherapy, which have worked in the past, with continuous innovative healthcare delivery, creating healthcare opportunities from the United States of America, Taiwan, Africa, and Russia, with healthcare professionals, systems, and health information technology, with personalized patient-centered approach, didactics, and healthcare delivery systems, pathophysiology, and specialization opportunities for effective healthcare delivery to pediatric patients, maximizing the early developmental years and continuous healthcare delivery throughout their childhood years to their adult years, creating healthy adults, and makes pediatrics my choice of specialty. My clinical career has been shaped by medical education and United States medical licensing examination scores of Step 1, Step 2 clinical knowledge, Step 2 clinical skills, Step 3 scores of 88 or 212, 98 or 257, pass 88 or 212, and improve the training for clinical rotations in the United States of America at Atlanta Medical Center and Crawford Lung Hospital, Atlanta, Georgia, observerships at Texas Health Harris Methodist Hospital, Fort Worth, Texas, in internal medicine, with Dr. Fidel Ezemili, and Huntsville Family Medicine Residency Program, Huntsville, Alabama, the Family Medicine in Training Service with the Program Director, Dr. Mary Cristani, and the inpatient team, externship at Resurrection St. Elizabeth Hospital Family Medicine Residency Program in Family Medicine with the Program Director, Dr. Saida Zahidi, and graduate medical education training at Henry Ford Internal Medicine Residency and Southern Illinois Family Medicine Residency Program, Springfield, Illinois, with the inpatient, outpatient, and obstetrics and gynecology, rotations, with program directors Dr. Kimberly Becker-Ginal and Dr. Janet Albers, and continuously updated with graduate medical education and caregiving in Dallas, Texas, and enhanced with a master's in business administration, core public health administration, and ongoing public health at Minneapolis, Minnesota. Collaboration with the American College of Physicians, American Academy of Family Physicians, American Psychiatric Association, American College of Obstetrics and Gynecology, and the American Pediatrics Association. With current practice recommendations, I've improved my accreditation council of graduate medical education core competencies tremendously, with core skills of comprehensive history and physical as a prospective intern in graduate medical education program. It was amazing to see the changes which occurred in the past few weeks in 15-year-old Caucasian male with caregiving, incorporating occupational therapy, speech therapy, and physical therapy with past medical history of cerebral palsy, whose chief complaint was abdominal muscle tone. Was abnormal muscle tone, asymmetrical crawling or failure to crawl, growth disturbance and failure to thrive, and gross motor developmental delay, which has improved progressively over the past few months. And family history of genetic disorders and current preventive care of daptofene, 15 milligrams twice daily orally, and phenobarbital, 100 milligrams per 10 milliliters, and no non-drug allergies, with concurrent review of systems and physical examination findings of decreased visual acuity of 20/200, 2 centimeters well-healed scar in the umbilical region with a gastrostomy tube, 2/5 muscle strength, decreased muscle tone and bulk, decreased coordination, normal sensory function, 3+ deep tendon reflexes, contractures, decreased range of motion, differential diagnosis of inherited metabolic disorders, metabolic myopathies, metabolic neuropathy, movement disorder in individuals with developmental disabilities, traumatic peripheral nerve lesions, tumors of the conus and cauda equina, and vascular malformations of the spinal cord with laboratory orders and findings of elevated serum lactate, pyruvate levels, ammonia levels, elevated organic and amino acids, cerebrospinal protein chromosomal analysis, imaging of computed tomography, CT scanning, magnetic resonance imaging, MRI, electromyography, EMG, nerve conduction studies with evoked potentials, consults with neurology leading to an assessment of cerebral palsy with a plan of continuing medications, feeding with gastrostomy tube, physical therapy, occupational therapy and speech therapy, follow-up in 3 months, and coding and billing of ICD-9343, ICD-10G80, and billing of 99205 as a new patient due to the comprehensive history, physical examination and high complexity decision making done in 60 minutes. My interest in pediatrics has been bolstered by clinical experiences in nuclear and extended family, basic sciences, pediatric, preventive health, and clinical experiences in medical school and graduate medical education, consisting of residency, externships, and observerships, and graduate medical education and preventive care, community education in Dallas, Texas, and has led to my interest in the various specialization opportunities available in pediatrics. This synopsis portrays a typical day in the life of an intern with patient care and with accreditation, council, graduate medical education core competency training from medical school, supervised by residents while maintaining a balanced life with hobbies and healthy mental and physical habits, which I hope to contribute while providing a collaborative environment for graduate medical education with my hobbies of Zumba dancing, charity works, participation in the Reach Higher initiative of the First Lady, Michelle Obama, and education on Drchikitomentoring Iridiscence education Ustreamyoutube, Cisco Beck's Gresham channel. We presume to join conservatorship of my 3-year-old son as a single mother, incorporating my strengths of dedication to medicine, interest in education and creativity, and experience from various graduate medical education programs, and achieve my graduate medical education goals within the next few years. I would also like to share the March overview, which can be found on my WordPress website. The March schedule, on September 9th, which is a Wednesday, by 2 to 3 p.m. Eastern Time, there was a live video chat, which I was opportune to participate on the 15th of September 2014 by 12 p.m. That was when registration opened. So on November 30th, 2014, 11:59 p.m. Eastern Time is the applicant early registration deadline. Any applicants, that's for NRNP. So any applicants who register after November 30th will be charged a late fee. January 15th, 2014, by 12 p.m. Eastern Time, rank order list entry begins at 12 p.m. Eastern Time. February 25th, 2015, by 9 p.m. registration deadline begins at 9 p.m. Eastern Time. March 16, 2015, March week begins. Applicants learn whether they match to a program, and for unmatched eligible candidates, the March week supplemental offer and acceptance program so also begins. On March 19, 2015, program directors received their confidential roster of matched applicants. On March 20th, 2015, which is a Friday, is March Day. Results are released at 1 p.m. Eastern Time. On March 23rd, 2015, which is a Monday, 1 p.m. ERAS will allow applicants to select non-match participating programs, the communication methods include phone, fax, email, or other methods. There are some stipulations for match participating programs. They can accept applications only via ERAS. They cannot use phone, fax, email, or personal contacts until after application has been received. They cannot extend offers outside SOAP until SOAP concludes. They cannot create positions for unmatched applicants until SOAP concludes at 5 p.m. Eastern Time on Thursday of March week. And positions can be created only for partially matched applicants. On March 23rd, 2015, which is a Monday, by 2 p.m. Eastern Time, SOAP eligible applicants must submit applications only through ERAS, beginning at 2 p.m. Eastern Time on Monday of March week. And candidates can start applying to match participating programs that are participating in SOAP. On March 26, 2015, which is a Thursday, by 2 p.m., SOAP concludes at 5 p.m. Eastern Time on Thursday of March week. I would also want to share some of my residency interview experiences. These are graduate medical education programs which I have been opportune to collaborate with and share my graduate medical education goals. I would, I'd like to share, my experiences and what I learned from their program. So the first program that I was opportune to interview with, which I've been opportune to share my goals with, is Southern Illinois University Family Medicine Residency Program, Springfield, Illinois. And I got the invitation to interview at this program during the interview season, and I replied the email to the coordinator, chose a date for my interview, which was a very nice experience with dinner the evening before, and an interview with the faculty and program director. And I was asked some questions which include tell me about yourself, what are your career goals, and also to discuss the case of shortness of breath. I was also invited for a second look, and I was opportune to tour the hospital, the clinics, and also the other programs facilities with the program director. on a separate day, which was not on the second look. And after getting to know about the program, I felt that my graduate education goals would be met by this program. I was also inspired by a quote by the program director, who is an educator, who said, some things happen for a reason. I eventually mastered this program and acquired 1 year of graduate medical education for this program. I'm very grateful to them. Another program which I was opportune to share my graduate medical education goals with is Southern Illinois Family Medicine Residency Program, Coverdale, Illinois. And I got the invitation to interview at this program during the interview season. I've accepted the invitation, chose a date to interview, and I had a very pleasant interview experience with a meeting with the residents the night before. Interviewed with the program director, faculty and residents, and also met with other residents and faculty. And this program also offers a second look visit, which is a very good opportunity to ask questions and to learn more about the program. Another program which I've been opportune to share my graduate education goals is Jackson Park Hospital, Chicago, Illinois. And I got the invitation to interview at this program, and I accepted the invitation with the program coordinator. And had a very pleasant very pleasant interview experience with interviewing with the program director and 2 faculty members. Was asked some questions which include discuss the case of mania, discuss the case of bronchiolitis. Attended the noon conference, toured the hospital, the clinic, and also met the faculty, residents, and staff. Central Michigan University College of Medicine Family Medicine Program, I shared my goals with them after I got the invitation to interview at this program, accepted the invitation, had a very pleasant interview experience with interviewing with the program director and 3 faculty members. I was asked to discuss a rewarding experience or patient case, tell me about yourself, and discuss healthcare reform. This program, and also attended the morning rounds and noon conference on dermatology with residents. I was opportune to tour the hospital and the clinics and meet the residents, faculty, and staff. I was also opportune to share my goals with Providence Hospital and Medical Center's Family Medicine Program, or St. John's Providence Health System. I got the interview invitation, accepted the invitation with the program coordinator, had a very pleasant interview experience by interviewing with the program director and 2 faculty members. I was asked, what are you looking for in the residency program? Tell me about yourself. I was opportune to meet the rest of the faculty, residents, and staff, and toured the hospital and clinic, and also with the faculty, residents, and staff. The University of Alabama Medical Center Huntsville Family Medicine Program is another program which I have been opportune to share my graduate education goals with. So I got the invitation to interview, accepted the invitation, and also had a meeting with the residents the evening before, and interviewed with the program director and 3 faculty members, and also attended the noon conference, and answered the questions that I was asked. What are you looking for in the residency program? Tell me about yourself. I was also opportunity to meet the rest of the faculty, residents, and staff, toured the hospital and the clinic, and also met the rest of the faculty, staff, and residents, and also complete an observership at the University of Alabama Medical Center Huntsville Family Medicine Residency Program, Huntsville, Alabama, which was a very good learning opportunity with patients, with white patients on pathophysiology, and improved my accreditation council of graduate medical education core competencies. I was also opportune to share my graduate medical education goals with University of Arkansas for Medical Sciences Regional Centers Northwest Family Medicine Program. I got the invitation to interview. I accepted the invitation. Had a very pleasant interview experience by meeting with the residents the night before, and also interviewed with the program director and 3 faculty members, and also attended a new conference and answered the questions that I was asked, which is what are you looking for in your residency program? Tell me about yourself. Tell me about your clinical experience in your medical school. And I was also opportune to meet the rest of the faculty, residents, and staff, tour the hospital and the clinic, and also attend the second look visit, which is a very good opportunity to ask questions and get to learn more about the program. I was also opportune to share my goals with our Memorial Health University Medical Center, Bessa University School of Medicine, Savannah Family Medicine Residency Program. I got the invitation to interview at this program, accepted the invitation. I had a very pleasant interview experience with a meeting with the residents the evening before. I interviewed with the program director and 3 faculty members, and also attended the note conference and answered some questions, which include what are you looking for in a residency program? Tell me about yourself, and tell me about your clinical experience in medical school, and also attend the second look visit, which is a very good opportunity to learn more about the program. I was also opportunity to share my goals with LSU HSC Family Medicine Residency Program at Lake Charles, Memorial Hospital, Lake Charles, Louisiana. I got the invitation, accepted the invitation, and had a very pleasant interview experience with the tour of the facility, and also interviews with the program director and faculty members. Attended the new conference and also had a meeting with the residents, and also answered some of the questions that I was asked, including what are you looking for in your residency program, tell me about yourself, and also was opportune to meet the rest of the faculty, residents, and staff, and toured the hospital clinic, and also I toured the hospital and the clinic. Baton Rouge General Family Medicine Residency Program, Baton Rouge, Louisiana. I was also opportune to share my goals with them I got the invitation from this program, accepted the invitation with the program coordinator, had a very pleasant interview experience with our meetings with the residents the day before the interviews, and also with the program director and faculty members and residents, and answered some of the questions, which I'll include what are you looking for in your residency program, tell me about yourself, and also attend the second look visit, which is a very good opportunity to learn more about the program. I apologize for the breaking transmission. I am going to continue sharing my graduate medical education goals in a few minutes here. So I was also opportune to share my goals with with St. Louis University Family Medicine Residency Program, Belleville, Illinois. I got the interview to the invitation to interview with the program, accepted the invitation with the program coordinator, had a very pleasant interview experience with a meeting with the residents the day before, and also interviewed with the faculty, the program director, faculty members, and the residents, and answered some of the questions that I was asked, which include what are you looking for in a residency program? Tell me about yourself. Tell me about your graduate, about your medical education, and also discuss the careers of the graduates and also cultural diversity. The next program is an Atlanta Medical Center Family Medicine Residency Program. I actually completed my medical rotations at Atlanta Medical Center, Atlanta, Georgia, and I got the invitation to interview at this program. And this program conducts some interviews throughout the interview season. Morehouse Family Medicine Residency Program at Atlanta, Georgia. I also got an invitation to interview at this program, and they also conduct interviews through the interview season. Cedar Rapids Cedar Rapids Medical Education Foundation Family Medicine Residency Program. I got the invitation to interview at this program, and accepted the invitation. Had a very pleasant interview experience, and I met with the residents the day before, interviewed with the program director, the faculty members, and the residents, and answered some of the questions that I was asked, which include what are you looking for in a residency program? Tell me about yourself. Tell me about a medical education. And also attend the second look visit, which is a very good opportunity to ask questions and get to learn more about the program. Hereford Hospital Wayne State University Program, Internal Medicine Program, Detroit, Michigan. I also got the invitation to interview at this program and accepted the invitation. Had a very pleasant interview experience with the program director, faculty members, and residents. Attend the new conference and also answer some of the questions that I was asked, which include what are you looking for in the residency program, tell me about yourself, and also attend the second look visit, which is a very good opportunity to learn more about the program. Wednesday University School of Medicine Program, Internal Medicine Residency Program, Detroit, Michigan. I got the invitation to interview at this program, and accepted the invitation, and also had a very pleasant interview experience with the program director, faculty members, and residents, and also attend noon conference and had and answer some of the questions which I was asked, which include what are you looking for in a residency program? Tell me about yourself. And this program also offers a second look visit, which is a very good opportunity to ask questions and get to learn more about the program. St. Vincent Charity Medical Center, Case Western Reserve University Internal Medicine Residency Program. I also was able to share my graduate medical education goals with them, and I got the invitation to interview at this program and accepted the invitation. Had a very pleasant interview experience with interviews with the program director, the faculty, and the residents, and also attend a noon conference and answer some of the questions which I was asked, which include what are you looking for in a residency program? Tell me about yourself. Also discuss the case of diabetes type 2, and also attend the second visit, which is a very good opportunity to learn more about about the program. Canton Medical Education Internal Medicine Residency Program, Canton, Ohio. I got the invitation to interview at this program, accepted the invitation. Had a very pleasant interview experience with meeting with the residents the day before, and also attended body report, had a tour of the hospitals and interviews with program director, faculty, and residents, and also attend the teaching rounds on one of the medical teaching services, and answer some of the questions which include what I'm looking for in the residency program, and tell me about yourself. University of Tennessee College of Medicine, Chattanooga Internal Medicine Residency Program. I got the invitation to interview with this program. Accepted the invitation. Attended the interview. Had a very pleasant interview experience, and met with the residents a night before. Had a tour of the hospital and interviewed with the program director, the faculty, and residents, and also attend the noon conference presented by one of the residents who expressed gratitude to the programs, and answered some of the questions which I was asked, which include what are you looking for in a residency program, tell me about yourself, and tell me about a medical school rotation. Louisiana State University Shift Board Internal Medicine Residency Program. I got the invitation to interview at this program, and I accepted the invitation with the program coordinator. Had a very pleasant interview experience, which consisted of a morning report, tour of the hospital, and interviews with the program director, faculty members, and residents, and answer some of the questions that I was asked, which include what are you looking for in a residency program, and tell me about yourself. Palmetto Health, University of South Carolina School of Medicine, Internal Medicine Residency Program, South Carolina, Columbia, South Carolina. I was able to share my goals with this program. I got the invitation, accepted the invitation with the program coordinator, had a meeting with the residents the day before, and taught the hospital and the interviews with the program director, faculty members, and residents. And answer some of the questions that I was asked, which include what are you looking for in a residency program? Tell me about yourself. Mercy Hospital and Medical Center Internal Medicine Residency Program, Chicago, Illinois. I was also opportune to share my goals with them, and I got the invitation to interview, accepted the invitation, and had a very pleasant experience, which consisted of morning report, interviews with the program director, faculty, members, and residents. Had a tour of the hospital, and also had noon lecture, and also answered some of the questions that I was asked. What are you looking for in a residency program? Tell me about yourself, and discuss the case of asthma. New Hanover Regional Medical Center Internal Medicine Residency Program. It's another program that I've been opportune to share my goals with. And I got this got the interview, accepted the invitation, had a very pleasant interview experience, which consisted of a morning report, interviews with the program director, faculty members, and residents, taught the hospital, and answered some of the questions, which include what are you looking for in the residency program, and tell me about yourself. Unity Health System Internal Medicine Residency, Rochester, New York. I actually got the invitation. I was opportune to share my graduate medical education goals with them. I got the invitation to interview, accepted the invitation. Had a very pleasant interview experience, consisting of attending rounds, specialist rounds, noon conference, interviews with the program director, faculty members, and residents, taught the hospital, and also answered some of the questions that I was asked, which include what are you looking for in the residency program, and tell me about yourself. Good Samaritan Hospital Internal Medicine Residency Program, Cincinnati, Ohio. It's another program which I've been opportune to share my goals with. And I got the invitation to interview, accepted the invitation, had a very pleasant interview experience with interviews with the program director, faculty members, and residents, taught the hospital, answer the questions I was asked, which include what are you looking for in a residency program? Tell me about yourself. So overall, it was a very enjoyable, collaborative experience, and I look forward to being able to share my graduate medical education goals with more programs in March 2015. I am going to go ahead and share my residency interview determination for the programs that I am hoping to share my graduate medical education goals with. Education is a continuing process. I hope that I can be able to be able to have this educational collaboration with you daily, and be able to share my educational goals with you. The application review committee of graduate medical education programs. Dear sir or madam, I would like to acknowledge the receipt of the determination of graduate medical education training interview. My dedication to healthcare, education, and medicine improved my career experiences in graduate medical education, motivates me to continue in the ongoing career path and emerge as a competent physician equipped to contribute knowledge from public administration and public health to graduate medical education in the near future, overcoming challenges of medical knowledge and clinical experience with standardized clinical solutions. Modern medicine with fundamental, time-honored clinical skills taught by medical educators in graduate medical education will contribute towards healthcare reform, fostering graduates with some limitations and creating healthier communities. I would like to collaborate with you and be able to share my graduate medical education goals and emerge officially licensed and graduate successfully to contribute towards clinical skill efficiencies and graduate medical education knowledge, and improving the health of population and reducing the per capita costs of healthcare. Thanks, and I look forward to hearing from you soon. I would also want to share my White House I would also want to share my essays for the White House internship program, which is the program designed to cultivate leaders. It consists of 2 essays, and I would like to share my first essay with you. At each and every juncture of our history, somebody has been audacious to say, we could do better. And more often than not, it's been young people who have done it. President Barack Obama, February 2nd, 2007. From time immemorial, education has created brighter futures, blazing the way for a progressive society led by innovative leaders, spanning from early childhood learning to higher education. The importance of a higher education in maximizing knowledge in various specialties with knowledge from research done by professionals, creating individuals armed with high performance knowledge and contributing to our society. The United States, with its expertise and history of education, of creating a trend of leaders contributing towards the society and making a positive impact on the lives of individuals around the United States and other countries, has zoned in on raising the bar of education, creating higher learning opportunities, integrating quality education stemming from early developmental years. The White House internship, with its unique opportunities for leadership acquisition with the various offices of the President from various functions, create leaders from the various offices of the President in various government structure, integrating administration, management, digitalization, policy creation, social media, with advancements of the country are leadership skills necessary for my career growth. The numerous issues which the United States of America has integrated into creating a superior economy with the American ideals, addressing issues of civil rights, defense, disabilities, economy, education, energy and environment, ethics, equal pay, foreign policy, healthcare, homeland security, immigration, refinancing, rural, service, seniors and social security, taxes, technology, urban and economic mobility, veterans and military families, violence prevention, women, joining forces, integrating a team-based innovative approach with behind-the-scenes snapshots on global health initiative, the Drink Up campaign, the White House Working Family Summit, immigration, the Rich Hire initiative, joining families, foreign policy, Let's Move initiative, military, credentialing and licensing, youth violence solutions for energy, environment conservation and social events have been addressed over the past year. The White House internship training developing the potentials of young leaders to create motivated changes in various regions of the country, gaining valuable professional experiences and building leadership skills, utilizing a hands-on program designed to mentor and cultivate today's young leaders, strengthen their understanding of the executive office, and prepare them for future public service opportunities, incorporating a galvanized trend in leadership in current times, are reasons behind my interest in the program. My leadership goals in healthcare, administration, and education with rapidly evolving healthcare changes, integrating healthcare initiatives for high-value care, current recommendations on demand, strategic plans involving mental health, coupled with my graduate medical education, ongoing process of being part of Accreditation Council of Graduate Medical Education core competencies, are diverse opportunities which I hope to acquire in service as a White House intern. I look forward to being accepted irrespective of my application. I'll be late in the application season due to my dedication to serve as a White House intern in the near future. My second essay. This program will mentor and cultivate young leaders of today and tomorrow, and I am proud that they will have this opportunity to serve. I look forward to working with those who are selected to participate, and I want to commend all who apply for their desire to help through public service to forge a brighter future for our country. President Barack Obama, May 22nd, 2014. Hello everyone, I'm Dr. Drchikitomentoring, and I would like to welcome you to Drchikitomentoring Ustream show. My introduction to my educational Ustream show with demonstrations of the quintessential skills of a history and physical examination, eliciting normal and abnormal clinical findings, integrating diagnostic finding, laboratory testing, imaging, procedures and consults, assessment and plan for patient care delivery, has led to my interest in the White House internship program. Career growth in clinical and leadership skills motivated by the above quote by President Barack Obama. Leadership creating brighter futures offered by the White House internship through the dedication of the President, First Lady, and staff, motivation and continuance of the American values inculcated to White House intern justifies my application to the White House internship program with the hope of attaining leadership skills in the varying offices of the president and emerge as a physician leader with the ideals and missions of the White House internship program as a definitive step in my career, subsequent to previous communication to the White House on domestic violence, sexual violence, presidential panel, and neighborhood safety. My life experience is shaped by family, education, cultural assimilation from diversity, visa lottery, relocating from Nigeria to the United States of America, benefiting from the justice system dedicated to equitable justice, and emerging as a divorced physician mother of a 2-year-old, leading to interest in the various offices of the White House internship, with special interest in working with the Office of the White Lady, with its various departments of Chief of Staff, Policy, Communications, Scheduling, Correspondence, and the Social Office, with a special emphasis on policy and the Social Office implemented into current health care practices with potential for career growth and leadership skills. The Offices of Cabinet Affairs, the White House Communications Department, Domestic Violence, Domestic Policy Council, National Economic Council, Office of Digital Strategy, the White House Office of Legislative Affairs, Office of Management and Administration, the Office of Political Strategy and Outreach, the Office of Presidential Correspondence, the Office of Management and Administration, the Office of Political Strategy and Outreach, the Office of Presidential Correspondence, the White House Office of Public Engagement and Intergovernmental Affairs, the Office of the First Lady, the Office of the Vice President, the Office of White House Counsel, the White House Office of Presidential Personnel, the White House Departments of Scheduling and Advance, and the Office of the White House Fellows include the various offices of varied potential. My optimism in the United States reinforces my application for the White House internship with potential for maximum integration of digital technology for the future. I would also want to share a letter from the White House. This is just a quick note to thank you for your birthday wishes. Messages like yours encourage me as I work to build a brighter future for all Americans. They remind me of what's of importance and what's best about our country. Again, I appreciate your thoughtful gesture. I wish you and your loved ones all the best. Sincerely, Barack Obama. I would also want to share my application for the Reach Higher initiative. It's 11:44 a.m. Central Time. And I want to encourage everyone who is watching to be more participative, to feel free to post on my social stream to encourage active participation. I would like to share my application for joining the Reach Higher initiative of the First Lady, Michelle Obama. Education is the key to success for so many kids, and my goal specifically is to reach out to directly to young people and encourage them to take charge of their futures and complete an education beyond high school. First Lady Michelle Obama, January 16, 2014. This inspiring quote by the First Lady is the reason for my wanting to propagate goals of the Reach Higher initiative created in 2014 by playing an active part in this initiative and its goals of inspiring every student in America to take charge of their future by completing their education past high school, whether at a professional training program, a community college, or a 4-year college or university in today's economy, with the insufficient nature of a high school diploma, urging students to reach higher, being part of the President's North Star goal, creating the highest proportion of college graduates in the world. It goes of expanding opportunity, inculcating the requirements for completion of education by exposing students to college and career opportunities, understanding financial eligibility, making college affordability a reality, encouraging academic planning and summer learning opportunities, and supporting high school counselors helping with college entrance. From time immemorial, education has been emphasized as a way of creating brighter futures and paving the way for innovation and spans from early childhood learning, education for K-12 students, and support for higher educational reform for the future. The American society shaped by educational initiatives have contributed to a society with a need for actualizing potentials existing in higher education, emphasized by the Reach Higher initiative, which I hope to pass along by creating awareness and active contribution towards the goals of the Reach Higher initiative. My life experiences, revolutionized by the educational and legal system of the United States of America, culture and a culture of hard work, responsibility and sacrifice, leading to my ideal depiction of inculcating chronic medical education curriculum review with its vision of creating optimal health, integrating modalities including chronic medical education and reinforcement on a continuous basis of the accreditation core competencies of patient care, medical knowledge and system-based practice-based learning and improvement, communication and interpersonal skills, and professionalism. I hope to contribute towards the goals of the Reach Higher initiative by playing an active part, illustrating the opportunities of higher education, streamlined from early developmental years, as an important part to success, incorporating other initiatives, including the Next Move campaign, the green approach, contributing towards my overall career goals. I also hope to inculcate your educational and career values by actively propagating your opinions on my Ustreamyoutube show, Iridiscence Education, and with the idea to motivate the young population to develop their language, mathematics, and science skills as a base for higher education. I would like to tap into the history represented by the White House, fostered by the innovative approach to the People's House by attending the American Academy of Family Physicians Assembly 2014 in Washington, D.C. as part of my educational projects with the sponsorship of the Office of the White Lady, the White House internship, and also the ideals of women empowerment by regaining joint conservatorship of my 2-year-old Kingston Eke with after 2 years of also custodianship and also overcoming the obstacles of posed by domestic violence poverty and lack of digital resources with personal experiences and a legal history transformed by the United States of America legal system. Thanks, and I look forward to hearing from you soon. Yours sincerely, Dr. Chinyere Ugochi, MD. I would also I want to extend talk about trending topics in public health. Currently, in my public health course, which has exposed me to public health on a global basis, and which has also helped me to understand trending public health topics. And Ebola is actually actually a current public health topic. I would like to share these some quick points about Ebola. So definition of Ebola, also known as hemorrhagic fever or simply Ebola, is a disease of humans and other primates caused by Ebola virus. So what are the numbers? What is the epidemiology of Ebola? Well, it has a high risk of death, killing between 25% and 90% of those affected with the virus. And as of 25th October 2014, the current outbreak in West Africa includes 13,703 suspected cases, resulting in the deaths of 4,922 people. Risk factors: healthcare workers who are treating those who are infected are at greatest risk of getting infected themselves with direct contact with blood or other body fluids, and also it can also be spread by semen or breast milk for several weeks to months after recovery. Fruit bats are believed to be the normal carrier in nature, and humans become infected by contact with bats or with living or dead animals that has been infected by bats. And then after human infection occurs, this disease can actually spread between people. So what causes it? It's caused by 4 or 5 viruses of the gene, Ebola virus. The four are Borgio virus, Sochan virus, Diphorus virus, and one simply called Ebola virus. In terms of signs and symptoms, because it's a wide variety of signs and symptoms, which include feeling tired, fever, pain in the muscles and joints, headache, and sore throat. The fever is usually higher than 38.3, 100.9 degrees Fahrenheit. This is often followed by vomiting, diarrhea, and abdominal pain, with shortness of breath and chest pain, which occurs along with swelling, headaches, and confusion. And in about half of the cases, the skin may develop a maculopapular rash, which is a flat red area covered with small bumps. And in some cases, internal and external bleeding may occur, which actually begins 5 to 7 days after the first symptoms. And other things that you have to think about include typhoid fever, shigellosis, rickety cell diseases, cholera, sepsis, borreliosis, leptospirosis, crop typhus, plague, Q fever, candidiasis, histoplasmosis. And also, we also have to think about non-infectious causes, which include acute pro-myelocytic leukemia, hemolytic uremic syndrome, snake inflammation, fatty factor deficiencies, and platelet disorders. In terms of diagnosis, there are some non-specific laboratory testing, which include a low count, also increase white blood cell count, elevated levels of the liver enzyme, ALT and AST, and also some abnormalities in blood clotting, which are shown in prolonged prothrombin time, plasma thromboplastin time. Some specific laboratory testing include detecting RNA testing to detect the polymerase chain reaction, and in terms of imaging, no specified imaging are needed unless the patient develops bleeding, and then you might need to do the computed tomography or magnetic resonance imaging. In terms of treatment, it's basically supportive, and we can give oral rehydration or intravenous fluids for symptomatic relief. And also pain management, nausea, fever, anxiety should also be treated. It's recommended by the World Health Organization to avoid the use of aspirin or ibuprofen due to the bleeding risk associated with these medications. Blood products like packed red blood cells or fresh frozen plasma may also be used. In terms of prevention, people who care for patients with Ebola should wear protective clothing. They should also be in barrier isolation from other people. And then also efforts are actually on the way to develop a vaccine. And also it can be eliminated with heating for 30 to 60 minutes at 60 degrees centigrade or boiling for 5 minutes. And education about these public health diseases is actually being done by the World Health Organization and the Center for Disease Control and Prevention, and also has been part of my public health topic project, which as part of my of achieving my graduate medical education goals. So the prognosis, how likely are you to recover, or what is the cause of this disease in terms of mortality and morbidity? EBV has a high risk of death in those infected, which varies between 25% and 90% of those affected. So, I will share my projects on public health, on my projects in public health and domestic violence, sexual violence, coming up soon on this show. I would also want you to log in to keep abreast of our show times by checking on the social stream, and also be more interactive on Drchikitomentoring Iridiscence educational show. And I want to thank you for watching this show, and wish you a wonderful rest of the day.